Hello, this is your online doctor, Dr. Samuel. I want to talk to you on this occasion about the peptic ulcer, having a wound in your stomach, how it manifests, what causes it, how to assess it, that is to see the severity, confirm that it's real, that you really have a wound in your stomach, and how it can be treated. So, an ulcer is a wound on the lining of your stomach. Just like in your mouth, you have a lining. That if the lining in your mouth is cut, there will be a wound and there will be pain. I'm sure many who listen to me would have experienced a wound in the mouth. It can be quite painful. So a similar thing can happen in the stomach. And in the stomach, we have acid, hydrochloric acid, which can also which will burn the wound and elicit pain. So an ulcer is a wound, as simple as that, a wound in your stomach. What causes an ulcer? There are multiple causes of an ulcer. The first of them is that you have excessive acid secretion. This usually comes from an inherited condition called the Zollinger-Ellison syndrome, whereby a child has a tumor, whereby a patient has a tumor, or an excessive multiplication of some cells that produce the substance gastrin. Gastrin prompts acid secretion in the stomach. So when you have a gastrinoma, an increase in the number of cells that produce gastrin, and this results in excessive acid production, that will definitely burn the lining of the stomach and cause wounds. So that's one aspect. The gastrinoma. That's the disease in the Zollinger-Ellison syndrome. Also, another cause of ulcers is repeated starvation, exposing the lining of the stomach to acid. Eating tends to dilute the acid in the stomach. Not eating leaves it concentrated and leaves the mucosa, the lining of the stomach, exposed to strong acid, and this can cause wounds from the acid burning the lining of the stomach. If sometimes you eat late in the night, starchy food, by daybreak you have wounds in your mouth. I'm talking about the mouth now. This is a similar situation. When bacteria breaks down the starch while you are asleep in your mouth, the acid can burn the mucosa of the mouth. The acid from the bacterial activity, or it can burn on the starch that you slept with in your mouth, can cause release acid that burn the mucosa of the mouth and cause wounds. So in the stomach, not eating regularly will leave the acid undiluted and burn the lining of the stomach. So it's important, it's necessary to eat regular meals. Then another cause of ulcers in the stomach is unconsciousness. Patients who are unconscious tend to develop stomach ulcers. Okay? They are called Cushing's ulcers. Patients who have large burns on their skin tend to develop ulcers too. The patients who are of a personality type who worry a lot also develop ulcers too. So these are the causes of ulcers, of wounds, ulcers in the stomach. An ulcer is just a wound in your stomach and will cause you pain because of acid burn on the wound. So, how do you assess an ulcer? First of all, how does an ulcer in the stomach manifest? It manifests as pain in the upper abdomen, pain near the umbilicus, the navel, or pain under the left side of the rib cage. That's where the pain of an ulcer manifests. That's just the sites where it manifests. Pain in the upper abdomen, pain around the umbilicus, or pain below the left side of the rib cage. So, that's the primary symptom of an ulcer, pain. There could also be vomiting. There could be fear to eat because of the pain that the eating may elicit. There could be pain after meals, after the person has eaten. So, yeah, so an ulcer, how can an ulcer be assessed? An ulcer can also be caused by a bacterial infection of the stomach, by a bacteria called H. pylori, Helicobacter pylori. These bacteria can infect the stomach and cause ulcers. So one of the tests that will be done for an ulcer is to do an H. pylori screen. Okay? If it's seen, there's a regimen, a combination of drugs for clearing it up. Also, an ulcer could be assessed by taking a sample of feces, a stool sample, and checking for occult blood, for microscopic bleeding. That could be an evidence of an ulcer, a wound in the stomach that bleeds. Another could be assessed through endoscopy, passing a lens down, passing the camera through the mouth down to the stomach to take a direct look for a wound in the stomach. Another could be assessed also through X-rays and contrast. X-ray and contrast will show a filling defect in the mucosa of the stomach. The process involves giving the person a barium meal. Barium is radio opaque, meaning X-rays cannot pass through barium. So when the person swallows a barium meal, the stomach will appear white on the X-ray film. If there's an ulcer, there will be a gap that does not fill the barium. It will appear dark. So that's a filling defect. So a barium meal will show an ulcer. It's one way of assessing an ulcer. Okay, so there's some modalities for assessing an ulcer. Okay, also a breath test could also be done for H. pylori. Now, an ulcer could become complicated if it bleeds excessively, if it bleeds frankly. An ulcer could bleed frankly, such that the patient's stool turns black. The blood, by the time it gets to the rectum, has been digested and the color changed to black. So the person with an ulcer will be passing black stools. The black stools indicate the person is bleeding seriously, because the distance from the stomach to the rectum is quite long. For blood to manifest, or a bleed to manifest in the rectum, it must be considerable. A person may also vomit frank blood, clear blood, because of a bleeding ulcer. An ulcer could burst through the line of the wall of the stomach, straight through, making a hole, such that stomach content discharges into the space of the abdomen called the peritoneal cavity. And this juice from the stomach is very, very harsh and corrosive. It will cause serious damage when it leaks out of the stomach, because it contains acid and digestive enzymes, and also contains bacteria. Okay, so those are two complications of an ulcer, which are very serious and may be lethal. An ulcer can also have a stone from a gallbladder. Okay, let's move on. Now, how do we treat an ulcer? So before I do that, I have to mention that an ulcer can also be caused by some painkillers like aspirin, ibuprofen, diclofenac, naproxen. These drugs they can cause ulcers because they inhibit a protective covering on the stomach of the lining of the stomach, a mucus protective lining on the mucosa or the lining of the stomach. These drugs prevent these secretions from being done to the extent that is necessary, and such the lining of the stomach becomes exposed to acid. So drugs like diclofenac, naproxen, aspirin, ibuprofen are not taken by patients who have ulcers and are not taken on the best or an empty stomach. Alright, so that's the point. So these drugs are another possible cause for an ulcer. People who have arthritis or another reason for taking painkillers for a long time, these particular painkillers, they're called NSAIDs, non-steroidal anti-inflammatory drugs. These drugs, if people take them for a long time for chronic pain, tend to develop ulcers. Okay, so the treatment of ulcers are treated by suppressing acid secretion so the wound can heal. The pain is caused mostly by the acid burning the wound. So if you suppress the acid, the wound can begin to heal. There are drugs for doing that. I will go into the drugs, okay, for ethical reasons. If you need to talk more on this matter, call my number, which I will leave in the description box. Now, so another modality for treating ulcers is to enhance this secretion that protects the lining of the stomach through another group of drugs. The prostaglandins. I could mention like prostaglandins, but I wouldn't mention the specific ones or the specific one that is used for the purpose. Okay, good. So also H. pylori infection, a cause I mentioned before of ulcers, is treated with the combination of drugs. So now, then, so people who have had surgery, and I cannot eat for a few days because of the surgery, because the intestines have become immotile from handling to do the surgery. Some of them may develop pain like an ulcer. So also now, apart from these drugs, the pain relief can be achieved using antacids. Antacids can be taken to cause relief of the pain by protecting those wounds from the ulcer wound from the acid. Antacids are anti-acid. They neutralize the acid, so the pain or the burning on the wound can be relieved. Alright, so then those who have ulcers usually some complain of having pain on eating some certain things. Often taking a drink, taking carbonated drinks, especially Coca-Cola, we can start off the pain of an ulcer because there was carbonic acid in it. Fruits too, called the citric acid, can also cause pain for other patients. So it's often wise for them to avoid these acids, these acidic foods until the pain and the ulcer has completely healed. Alright, so then for those who have ulcers, for those who are unconscious or who have bones injuries, their physicians will be aware or expect to be aware that they could develop ulcers. And may have to take measures to prevent that happening. For those who have a personality type that approach having ulcer called worrying, they will need counseling and information to know that it could be harmful to them. So thank you very much for watching this video. I'll leave my number in the description box so you can talk to me further if you want to. Thank you very much.